How does alcohol affect the human body? Have you ever wondered what really happens inside your body after you drink alcohol? For many people, alcohol is part of social gatherings, celebrations, or relaxation after a long day. But beneath those temporary feelings of pleasure lies a complex chain of biological events that affects nearly every organ in the body. Welcome to Good Health Zone. Please, if this is your first time on my channel, do subscribe, like this video, and turn on the notification bell for more interesting videos. Alcohol is a central nervous system depressant. This means it slows down the activity of your brain and nervous system. Within just a few minutes of taking your first sip, alcohol enters your bloodstream and begins affecting your brain, liver, heart, stomach, and other vital organs. While occasional drinking may produce temporary effects, repeated or excessive alcohol use can lead to serious health problems, including liver disease, heart disease, weakened immunity, and an increased risk of several types of cancer. In this video, we'll follow alcohol's journey through the human body and discover both its immediate effects and its long-term health consequences. What happens after the first drink? The moment alcohol enters your mouth, your body begins processing it. Unlike most foods, alcohol doesn't need to be fully digested before entering the bloodstream. Around 20% is absorbed directly through the lining of the stomach. The remaining 80% passes into the small intestine, where it is rapidly absorbed into the blood. Once in the bloodstream, alcohol travels throughout the body within minutes. Your heart pumps alcohol-rich blood to every major organ, including the brain, liver, lungs, kidneys, and muscles. Your liver immediately begins working to remove alcohol from your blood. However, the liver can only process a limited amount every hour. If you drink faster than your liver can break it down, alcohol begins to accumulate in your bloodstream. As blood alcohol concentration rises, the effects become more noticeable. This is why drinking multiple alcoholic beverages in a short period can quickly lead to intoxication. Effects of alcohol on the brain. The brain is one of the first organs affected by alcohol. Normally, billions of nerve cells communicate through electrical and chemical signals at incredible speeds. Alcohol interferes with these signals, slowing communication between different parts of the brain. At first, this slowing effect may feel pleasant. Many people experience reduced anxiety, increased confidence, and fewer social inhibitions. However, this relaxed feeling is actually the result of reduced brain activity, not improved brain performance. As alcohol levels continue to rise, judgment becomes impaired. People become more likely to make risky decisions they normally wouldn't consider. Reaction times become slower. Balance and coordination begin to decline. Speech becomes slurred. Vision becomes blurred. Concentration becomes difficult. Memory formation is also affected. During heavy drinking, some people experience blackouts, where they remain awake but later cannot remember what happened. Because alcohol affects coordination and judgment, it greatly increases the risk of road accidents, falls, drowning, and other serious injuries. The liver is one of the hardest working organs in the body. Its job includes filtering toxins from the blood, and alcohol is one of those toxins. Every drink requires the liver to work harder. Special enzymes inside liver cells break alcohol down into different chemicals before it can be safely removed from the body. But repeated heavy drinking overwhelms this process. Fat begins building up inside liver cells, leading to alcoholic fatty liver disease. If drinking continues, inflammation develops, causing alcoholic hepatitis. Over time, healthy liver tissue is replaced with scar tissue. This condition is called cirrhosis. Unlike healthy liver cells, scar tissue cannot perform the liver's essential functions. As cirrhosis worsens, the liver gradually loses its ability to filter toxins, regulate blood clotting, and support normal metabolism. In advanced stages, liver failure can become life-threatening. Alcohol also affects the digestive system almost immediately. It irritates the lining of the stomach and increases acid production. This irritation often causes burning sensations, stomach pain, nausea, and vomiting. Heavy drinking may also interfere with the absorption of important nutrients such as vitamin B12, folate, and other essential vitamins. Over time, chronic irritation may damage the stomach lining and contribute to ulcers and gastrointestinal bleeding. The digestive system becomes less efficient, making it harder for the body to obtain the nutrients needed for good health. Alcohol also changes how your heart and blood vessels function. Soon after drinking, blood vessels near the skin widen. This creates the familiar sensation of warmth and causes facial flushing. Although you may feel warmer, your body is actually losing heat more quickly. With repeated heavy drinking, the heart itself begins to weaken. The heart muscle becomes stretched and less efficient at pumping blood. This condition is known as alcoholic cardiomyopathy. Alcohol can also increase blood pressure and trigger abnormal heart rhythms. Over time, these changes raise the risk of heart attacks, strokes, heart failure, and other cardiovascular diseases. Alcohol doesn't only affect major organs, it also weakens your body's natural defenses. The immune system relies on specialized white blood cells to fight bacteria and viruses. Alcohol reduces their effectiveness, making infections more common and recovery slower. Long-term alcohol use also affects hormone production. In men, testosterone levels may decrease, reducing fertility, muscle strength, and sexual function. Women may also experience hormonal changes that affect reproductive health. Alcohol also interferes with the activity of bone-forming cells. As bone production slows, bones gradually become weaker and more likely to fracture. Over time, this increases the risk of osteoporosis. One of the most serious long-term effects of alcohol is its link to cancer. When the body breaks down alcohol, it produces a toxic chemical called acetaldehyde. Acetaldehyde damages DNA inside cells. Damaged DNA increases the likelihood that cells will grow abnormally. Over time, these abnormal cells can develop into cancer. Research has shown that alcohol increases the risk of cancers affecting the mouth, throat, voice box, esophagus, liver, colon, rectum, and breast. Importantly, there is no completely risk-free level of alcohol consumption when it comes to cancer. The more alcohol a person drinks over time, the greater the risk becomes. Alcohol affects nearly every organ in the human body. While some of its effects are temporary, repeated drinking can gradually lead to permanent damage. The good news is that reducing alcohol consumption, or avoiding it altogether, can significantly lower many of these health risks. Making informed choices today can help protect your brain, heart, liver, immune system, bones, and overall quality of life for years to come. Thank you for watching. If you found this video informative, consider sharing it with others. Raising awareness about alcohol's effects can help people make healthier decisions and protect the well-being of those around them.